I've been in Girl Scouts since I was in kindergarten. My mom actually started my troop. My mom actually bought the American Girl doll Care and Keeping of You books for me. And one of the books, it taught you how to do a self-exam, and I just started doing them. And that's how I actually found it, was just by feeling it, and I found it that way. So when I was told it was a tumor, I wasn't really surprised, but I was still kind of sad and disappointed, I guess.
So Keely initially felt this lump, and she notified her mom and had the normal workup, which included an ultrasound. She then had increased growth of this lump, which prompted her to come see me.
Well, everyone at Parkview was very nice and very kind. I didn't feel like an alien coming into the hospital, or I didn't really feel like a child either.
It's not unusual for a lot of teenagers to be nervous about surgery. For Keely, she was nervous about surgery, so much that she wanted to think about it and have more conversations with her mom. So we set up a close follow-up visit so we could have more discussions. And I think after talking about it a couple times and knowing what to expect, she felt much more comfortable.
Dr. Harley was my surgeon, so she took care of that side of things, but she was also really nice and caring when it came to the treatment.
Once we decided the best option was to do surgery to remove this, we did this as an outpatient surgery. So she came in, had her procedure, had this removed, and then went home the same day. For each patient after surgery, we develop a plan moving forward of how we're going to follow them. Some patients need closer follow-up than others. For Keely, we're seeing her every 6 months to continue breast exams. Eventually, we'll start to space that out, and she's really reliable of doing her self-exams, and we'll be aware if anything changes.
It feels like it never happened in some regards. I mean, I have appointments where I go and see how I'm doing, but I'm not in pain. I didn't expect it to really happen to me. It's not really a common thing for someone my age to have this kind of issue, but it does happen.
Women of all ages, I recommend being in tune with your body, know when something changes, and don't be afraid to speak up and come see us.
I didn't know anyone that had this happen to them, so I definitely felt like I was different from other people my age because I was so in tune with myself that I found this. But I'd say that I'm probably thankful that I did find it, because now I can tell other people about it and help them stay safe as well. The Gold Award is the highest achievement that a girl can earn in Girl Scouting. When they tell us to pick a topic for the Gold Award, they tell us to make sure it's personal to you and that you have a drive to want to achieve the award with this topic. So I am creating a patch program for older Girl Scouts to earn. Anyone who's a cadet, senior, or ambassador, or in middle school or high school can earn this patch. And it talks about just different kinds of breast health, whether it's self-exams, or a properly fitting bra, or any other thing that may be seen as taboo in this area.
I think Keely is an amazing young woman, and she's going to do great things. The fact that she took this experience and wants to help others just shows, who she is and her character, and I hope she just continues with this project to help other women be informed of what they need to know for breast health. And I commend Keely for what she's done, and we're really happy to have her part of our team here at the Breast Center.